how to palpate your iliac crest already. Look for your assist. And then run through here to find the crest. The crest now. Your assist is here in front. Then your assist. Then you have your posterior superior iliac spine. Just follow posteriorly. Just follow your crest. Your posterior superior iliac spine form your wall of venous.
Hi, babe.
Love you, babe. Beside the impulse, your TSIS. Inferior to that is your posterior inferior iliac spine. So, ang inyong bantayan, kung makita mo sa posterior superior iliac spine is your impulse venous. Impulse venous. Okay? Next, greater to counter. Wala naman kami kung paano yung palpate, diba? Position the patient in supine, and then you locate for the hip, and then you roll. The greater trunk will roll forward. Okay, so greater to counter. Next, you have your medial femoral condyle. Sit. Ito sa edge. Tandaan nyo ang posisyon ng patient.
Sa lipat na ako.
Ha?
Nagkamay.
Sir. Sir.
Kapoy na siya. Sabi niyo.
Okay, so you have here your knee joint. This is your tibia here, di ba? Your fibula is found laterally, pero hindi siya palpable. So, ano yung inyong condyles, no? So, below, rounded na siya, it's found posteriorly. And then, proximal to that, you will find your epicondyles, ari ang duwa mo, mukul scaled.
Pero condyles, so una-una mo.
Ang condyles, ari sa dalo, ari yung sa likod, bilog na siya yan. I-distinguish nyo So, it's found lateral, you have your lateral condyle and your medial condyle, and they are rounded, no? Distal to your epicondyle, and it is just right around your knee joint. So, ari your condyles. Tutulan nyo dabla? Femoral condyle. And then, just proximal to that, you will have your epicondyle. Gamo na siya mo. Ang inyong structure sa condyles, hindi ba may condyles ka mo? May gamo ng inyong femur. Mapunta sa femur, yung mo na siya mo epicondyle sa condyles sa dalawang mga bilo. So, ang condyle na doon kabilo ka mo niya siya sa dalawang. Saka ka lang sa kilid, ari yung epicondyle. Ang yung feeling doon pala yung sinyo. Epicondyle niya. Doon mo maniya rin mga bilo.
Naman niya,
Ito mo pulo.
Balik sa previous day, sir, ang epicondyle.
Ari yung epicondyle, Ang condyle siya ari sa dalawang. So, ano yung condyle siya? Condyle. Yung epicondyle sa dalawang. Okay? Next. Your adductor tubercles are found medially, sa medial, just proximal to your epicondyle. Adductor tubercle superior to the medial epicondyle. Nakita ang medial epicondyle. Superior. Medyo sakit na siya kung tumukod.
Ang sir?
Adductor tubercle. So, medial side. Sa adductor siya. So, may tama ng mga adductor epicondyle. Kundi, epicondyle na siya. Ang tubercle, yung gubukol mo na siya gamay mo structure sa inyong epicondyle, medial epicondyle. So, ano yung medial epicondyle? Yung tao nyo lang diyo. Gubukol na sa structure. Sakit na siya. Oh, sakit. Medyo tense na. Sakit. Slide. Sakit dito tayo. Epicondyle mo. So, it's somewhere here. Okay? So, mamangkot hindi yan ang adductor tubercle is medially located, just superior to your medial epicondyle. Okay? Yan ang medial epicondyle. Okay? Dito pa pero. Next. you have your muscles. Unang, inyong psoas. Gusto, naginig ko ng paa mo, Mark.
Wow, leg.
Bye. Sorry, oh. Iba ng grip ni JC.
Kalam.
So you have your psoas. Okay? So tell the patient to, anong position sa patient? Sitting. Sitting. Okay.
Hi, family. Hi, family.
What is, ang ining mga structures your iliopsoas and your rectus femoris will both have the same instruction, which is to tell your patient to lift his leg off the table. Sige. Sige, sabi. So, ari mo rectus femoris, ang iliopsoas mo diri sa babaw. Ari mo ba siya ganun yung rectus femoris? Ari siya laba, structure siya laba. So, ari rectus femoris. Diwat. Inaya lang. Diwat.
Meow. Sabat-sabat.
Sorry, tingin mo. Aling rectus fem mo yun? Di siya mag-ikaw.
Teya. Kapag wala lang Teya. Ayan lang Teya.
Sige. Flex. Wala, rectus fem niya. Mabat sa siya gano'n yung pakuplak niya sa'yo. Ano na tayo?
Teka, nakatay.
Rectus fem na mo to siyang direct sa dako. Ang bala mo na siya kay dako siya ng muscle, ang imo nga yung isuwas gamay lang gina sa'yo. So hindi mo na siya, dumapalbate mo man siya, pero limited na siya mo dahil. Sorry, yan imo yun. Okay, next you have your sartorius. Now for your sartorius, just tell the patient to do this one. Okay? So, palpate the origin of the prostate and the prostate line. Everything yan nasa So, medial is found medial to your rectus fem. So, kung rectus fem niya, tupad sa rectus fem mo.
Gabi ang iyang gastro.
Okay? Next.
Kuya mo ko ganun.
15 years kay side line. Yak wrong side. Okay. Now these are structures that can be palpated on the lower aspect. Lower leg.
Hindi ko ano yan. Yan.
Instruct the patient to lift your leg up toward the ceiling.
Okay, lift your leg up towards the ceiling. Actually, damo, isilang palpate mo. You can have individually separate each muscle ng mga adductors mo. So, katililipon na natin silang pectineus mo, adductor mo, kagang imo nga gracilis, tulong mo. Pero, tandaan nyo lang, na ini silang group of adductors will have the same action, which is adduction. Okay? So, you don't have to really identify them one by one. You just have to be familiar that the position of the patient is side-lying with the examined leg below. Okay? So, they palpate for your adductors. So, damo ni siya, ang gracilis mo, hindi ko na siya ma-differentiate. You cannot distinguish each adductor from each other. But if you tell the patient to perform and lift the leg up the bed, you will be able to palpate groups of muscles in the abdomen, which are all your adductors.
Malingin ninyo, no? Kaya man ang video na tawag.
Check.
Naging
So, pectineus, gracilis, Dr. Magnus, Dr. Locus, and your Dr. Brevis. Same.
Nauwi ako. Kaya naman ba siya? Filler.
Next, gluteus max.
Kamu, Milky. Kamu, gusto ka sa
So,
ligo
just
mo.
flex the leg. Gluteus max na yung hindi mo na ipagpalpate na. Okay, lift your leg up. So, you have your gluteus max isolated. Next, you have your semi-ten, semi-mem, and your biceps femoris. Doon naman yung SMMT. Hindi mo niya muna siya lang. Pero generally, just remember, everything that is in the medial area, are your tendinosus and your membranosus. And then the lateral side, you have your biceps femoris. Okay? So try to raise your leg off the table, sir. Okay, hold it, hold it. Now you cannot distinguish which of the two is your semi-10 and semi-mem. No? Your semi-10 is broader than your semi-mem. Semi-mem po yan, itong isa lang kita siya yan. I'm sure you've seen it kasi ako. Okay, next, you have your biceps. So, ano siya laterally.
As a broad, sir, ang
Mem ang broad. So ang semi-tendinosus usually is the shot the mas nipis at mas acute. So only po semi-tendon po. Kasi may mem po yung broader siya mas lapad kasi yung tendon na liguro. Semi-mem ang semi-tendon. Sige ba, sige biceps. Okay. Next, you have your gluteus medius. So tell the patient again to be inside lying. This time, the tested limb is the one on top. So ang inyong gluteus med, so tell the patient to abduct the leg. Okay, or lift the leg up. Okay, how about your gluteus minimus?
Palpate the lateral aspect of the pelvis. At that insertion, at the insertion, difficult to distinguish from the
From the medius. Okay, so it's very hard to distinguish these two.
Hindi na cover
Last is your tensor fasciolata. Tensor fasciolata.
Side lying pero
Extended.
palpate the muscle, the proximal anterior lateral thigh, slightly distal and posterior from the axis, and the iliotibial bands in the lateral thigh. Ask the patient to lift your top leg towards the ceiling.
So I think flex niya siya or slightly extended siya. Sige. Okay? Thank you, JC. Very self-explanatory.